Good morning, everyone. Debbie Reed here at Think Healthcare Solutions, Trust About Healthcare, and the Altitude Academy. Welcome. This is Ask a Frustrated Nurse, episode 23. It's kind of early this morning, so I'm kind of just getting warmed up. So I'm looking at my Becker health information news, and the one thing that there's a few things going on, but I'll just try and keep this short. So I talked about United Healthcare buying Change Health. Change Health is an AI-based company. They do the billing part of things. So does Optum, which is owned by United Healthcare. So here's an article. Now this is from the 3rd, and I missed it from when I reported, but one of the things that they're trying to do, and something I learned in this article that I did not know, is that they're looking at selling off pieces of both Optum and Change in order for this deal to go through. So the other thing I didn't realize is that Optum owns one of the biggest ASC chains in the U.S., Surgical Care Affiliates, and the company plans to grow its data capabilities, could be in jeopardy after the Justice Department sued to stop the acquisition. So it kind of saddens me, and I'd have to do a little bit more research. Surgical Care Affiliates. I'm not sure, and it's an ASC chain, which is a surgical center. I wish that none of the small ASCs were affiliated with big hospital corporations or insurance companies, nonetheless. I think it's a conflict. And particularly when they've cut the doctors out from being hospital owners. What is the difference? Not what is the difference. Why should insurance companies and major hospitals be allowed to have that ability to have patients over at these ASCs? So I would love if a group of docs could own surgical care, or a group of nurses be able to have this company instead of Optum and United Healthcare. I'm so over the whole mess. I wished I had a lot of money in my back pocket and people that in the know that could make that happen, or even a cooperative private group of citizens that my head always thinks of other ways of getting around some of these big companies. So anyway, that I would hate if they try to do this. I don't want them to. Regardless, it still falls in that category where Optum would be the main billing entity, whatever, the whole thing with Change. I don't want this to go through regardless of what they do, but I hope that Surgical Care Affiliates doesn't fall into somebody else, anybody else's hands, other than, like I said, it would be really, really great to see an entity be able to pick that up that can really do good things with it. I'd do great things with it, but hey, I don't have the money. A private equity firm is building an $18 million plaza in Texas that includes an ASC. Interesting. Huh. private equity firm Hames Partners is building an $18 million medical plaza with an ASC in McAllen, Texas. The Jackson Medical Plaza will house the McAllen Endoscopy Center, a joint venture between physicians and HCA Healthcare, as well as a gastroenterology practice, the Texas Digestive Specialists, which is a big group, and it's tied to another big group. So, not too much else going on. They're talking about. They did mention COVID. That what did I say? That COVID's supposed to jump 54% according to Mayo Clinic by April 23rd. So we'll see where that goes. Four systems are combating health misinformation. One can only assume what they're doing there. And of course, they're talking about the incubation period of Omicron as a 3-day window. And I'm going to close on this note. I really don't want to go into any more of the nonsense going on. Duke is buying another big, huge 400 physician practice. Doctors are not happy with that. And finally, MD Anderson it's the University of Texas MD Anderson Cancer Center is naming a physician as the Chief Diversity, Equity, and Inclusion Officer. I don't have any words for that. I think there's more important things. Patients should be treated equally. It should never be an issue. In my lifetime, it never has. I come from California, and even though I'm old, I've seen diversity, and people are people when they're laying in that hospital bed, or when they come to a hospital facility. We're one and the same, and I kind of resent that we're having to be forced with these labels and all of these special groups and stuff. I mean, I just now, taking care, doing that with our children, that's a different thing. It's being forced crazily, and it's. I don't understand. I guess that's my old part. But I just don't understand why. I've taken care of many different shapes and sizes and types and people, and I resent having to be told that we need diversity, equity, and inclusion. My favorite doctors have been black. My favorite, on and on. I don't feel like this is the biggest problem on the planet that we need to be. It needs to be all encompassing. So on that note, please tell us your thoughts. Please like and subscribe us so we can continue discussing our healthcare and how we can save money and how we can be safe, and how we're not taken advantage of as consumers. There's another article that I'll address tomorrow, and we'll discuss that. But on that note, have a great rest of your day, a great happy Tuesday, and stay warm and dry, and see you tomorrow.